In this video, we are going to talk about an upper trunk and lower trunk rotation technique known as total motion release, how to do it within the total motion release principles, and when it would be appropriate for your baby. Stay tuned. Hi, I'm Dr. Lauren Baker, a pediatric physical therapist, and on this channel, we help proactive parents and their babies move better. Think of me as your physical therapy bestie, here to help you learn how to help your babies move with confidence and ease. In today's video, we are going to talk about a technique called total motion release, also known as TMR, and more specifically, the upper twist, lower twist. Let's get into what total motion release is. I'm going to do a big long video on my experience with total motion release. I, at the time of recording this video, have taken the level 1 course. There are 3 levels of the course, so I am not by any means a seasoned expert. It is still a technique that is new to me, but is a technique that I absolutely love, and I have immediately begun implementing with my kiddos. Total motion release is a modified strain counter strain principle, which is a bunch of fancy words to say that you shorten a muscle to relax the muscle, and then you gain range of motion in the opposite direction because the muscle that you shortened was able to release itself. It is a gentler form of increasing range of motion compared to our traditional strategies of lengthening the muscle through stretching. When you stretch a muscle, you pull on that muscle and it becomes longer, and that's where you get that uncomfortable feeling. Total motion release, you are actually shortening the range of motion instead of pulling on it longer. So it's essentially the exact opposite motion, but you're getting the same end goal, which is to go from a shorter range of motion. Maybe you can only move this much. So I could either force it open or I could shorten it. As long as I'm able to extend my hand at the end of the day, the strategy that I utilized is effective. So you want to focus more on the end goal versus the means to the goal. And with TMR, it tends to be a really great strategy, both for adults and kiddos, but specifically for kiddos, because it's a lot gentler than the lengthening version. So in this video, we're going to talk about the upper twist and the lower twist. Now, what's important to remember with total motion release is that first, you want your child to be evaluated by a provider, usually a physiotherapist or physical therapist, or at times like an occupational therapist could also be trained in TMR. But you want your child to be evaluated in person or online by a licensed therapist to walk you through those motions or test them on the kiddo themselves in order to be able to tell you which direction is the right direction for your child. So if you're watching this video and your child has not been evaluated by a pediatric physical therapist, make sure you check the pinned comment, or you can reach out to me via email to try and find a TMR certified individual in your area. Your kiddo is being seen by me, or you have also been seen by a pediatric physical therapist and you know which direction your child goes into that is easiest. You may utilize this resource as a way to just remember where to place your hands, what to do, and things like that. But again, I discourage anyone just trying this out and utilizing these principles without being trained. So let's get into how to do it. You want to go to the direction of ease, and you only want to hold one direction. So with TMR or total motion release, if you are doing it within the principles of total motion release, you only want to do one side. It is the opposite of stretching, where I would stretch my left leg and then I would stretch my right leg to feel equal. If you do both directions utilizing the total motion release principles, you're going to negate the effects and decrease your results likely. So make sure that you're only going into the direction of ease and the direction in which your physiotherapist or physical therapist has instructed you to utilize. At times, babies can switch directions. Again, that's a little bit more complex for this video, but I do want you to know that it is something that does happen. And so if that is the case, definitely make sure to reach out to your provider, or if it has been a while since you've seen your provider, definitely let them know so that you can try to kind of figure out if those directions need to be switched. So I've got one hand under her arms, and then one hand is going to go through your legs. Oh, thanks for helping. And then I'm going to rotate over, and we're just going to hang out here. Her chest is facing forward. Yeah, you waving to all the friends? You waving to all the friends? I might give her little bounces. We might go look out the window. We might say hi to mama. And so we're going to spend about 1 to 3 minutes, depending on the kiddos. Yes, mama silly. The kiddo's tolerance. If it's only 10 or 15 seconds, that's fine. You just use that as a starting point and go towards that. Say, we have the best mama. She's so nice to us. She makes this so easy. We have such a calm baby. Now, if you have a really long baby, you might have to do this sitting down, or you might have to, if you have a really heavy baby, you might have to do it sitting down and for less time, because this is a good arm workout, let me tell you. Yeah, good stretch, good stretch. And then as they get looser, you might be able to go just a little bit further, but again, they'll let you know that we didn't like that was a little too far. That's okay. Boo, boo, boo. Bum, 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 bum. So she extended her legs, which means that she was over it. Oh, ooh, ooh, ah, 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 ah. I'm gonna always go to her tolerance. Boop. Ooh, camping lanterns. That's so cool. Say, is that so pretty? Say, you make my videos so much more entertaining than a baby doll. Let me tell you, even when I'm editing them, I have so much more fun. I'm like, I just want to watch my little baby friends. And it's also so sad because you get so big. You get big faster than I can edit them all. Yeah, okay, we all done? So you can tell that she extended her legs. Bum, 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 bum. So she extended her legs, which means that she was over it. Oh, ooh, ooh, ah, 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 ah. I wanted to come in with baby Eric and share a little bit of a few tips with you guys on how to remember which direction that you're doing. So when you hold the baby, if I bring my right arm underneath baby Eric's arms, that is going to be upper trunk right rotation. And I'm going to bring my left hand underneath his pelvis and bring my hand on his buttocks and rotate. And so I'm going to put him in a position where he is in right upper trunk rotation and left lower trunk rotation. Now, if I switch that, it is going to be my left arm that goes underneath his arms. That is going to be left upper trunk rotation. And then if my right hand goes down, it is going to be right lower trunk rotation. Now, when you are working with a baby, you really want to keep that hand on their bottom, on their pelvis. We do not want to be pulling on these thigh bones or this hip joint. All of the motion should come from the pelvis and not from the hip joint here. So when you bring your hand through to the back, you really want to make sure your hand is on their booty and you're rotating them from the butt and the lower back and not from the hips. So those are a couple of really important tips that I wanted to add in there after we watch that video. Now I'm gonna walk you through a little bit more on some tidbits and what I really want you to focus on when you're watching this video. As I'm walking around, I'm kind of bouncing her. You can move around, you can do different things. You can see from this side that my hands go through the front of her legs. Again, if you are doing a total motion release technique, you only want to do one direction. So you're not going to do both directions. This is just for demonstration purposes. If it's easier for your child to go in right rotation of their upper trunk and left rotation of their lower trunk with your right arm underneath their armpits, then that is the only direction that you're going to do. You're going to do that for 2 minutes, and then you're going to follow it up with 30 seconds of bouncing. Here you can see me just demonstrating that 30 seconds of bouncing. And that's a wrap, friends. Thank you so much for taking the time to learn about total motion release, the upper twist, lower twist, positional release, how to utilize it to help your kiddo if your kiddo is being seen by a pediatric physical therapist, and really just going on YouTube and trying to learn as much as you can about A, how your baby is moving, and B, how you can help them move better. If you have more questions, or you think, hey, maybe this total motion release technique might help my kiddo, or I'm just really feeling like their trunk is tight and I just would like to learn more information about mobility, the seasons of life and movement that a kiddo could be in, and how everything fits together, definitely make sure you check the pinned comment, because there's going to be a link for you to schedule with me, and we can answer all of your questions and make sure you feel really comfortable navigating this season of movement that your baby is in. As always, make sure to check the videos at the end so that you can hit up the core strengthening playlist, or check out the playlist tab so that you can pick the specific playlist that talks about walking, crawling, rolling, whatever season of movement that your baby is in. If you do subscribe, make sure that you let me know in the comments. I absolutely love interacting with everyone who finds these videos helpful, and more importantly, parents and people who really have a high value on being proactive and learning as much as they can to help their kiddos move better.